Hello, this is Optimum Health For All. I'm your host, Prof Odili.
Optimum Health For All, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's Optimum Health, yeah, it's for all.
Today we have President of the Nigerian Cardiac Society, who is also a past president of the Nigerian Hypertension Society, Professor Augustine Odili, on this program. We have him here to talk about the heart diseases, and other issues relating to heart and heart diseases. We're going to concentrate today on environmental pollution and heart diseases or heart disorders. So, Professor Odili, you are welcome.
Thank you very much, sir, for your kind invitation, and I'm very happy to be here. And yes, I'm the current president of the Nigerian Cardiac Society, but I was actually vice president of Nigerian Hypertension Society.
Okay, well, a president is a president.
Thank you very much, sir.
Yes, thank you. Thank you for honoring our invitation. Now, let's go to the part of the matter, which is environmental pollution and cardiovascular disorders. What pollution are we talking about when we talk about environmental pollution? And how do they relate to cardiovascular diseases?
Okay, thank you very much. The pollution, when you talk about environment, you talk about everything that is surrounding us. It could be air, it could be water, it could be noise, it could be from the soil that we plant our food. We can get, if the soil is polluted, we can get things that may be dangerous to our health from there. It could also be water. The water could be polluted. But in all this, especially for the main thing we are discussing today, the main issue really for us is air pollution. Every other aspect of pollution can also involve the cardiovascular system, but air pollution is the key, which is, chemicals and, substances in the air that we all breathe. The interesting thing about air pollution is that everybody is exposed. You can't avoid it because the same air that the poor breathes, that's also the same air that the rich breathes. So air pollution is very critical to our health. And that's why I'm very happy with the fact that I've been called to speak on this. Subsequently, we will now get the area that concerns us more, which is aspect of health that concerns us more. Thank you very much.
Thank you. So that will be, for you as president of Nigerian Cardiac Society, cardiovascular disorders, cardiac diseases.
Yeah.
Now, how can we relate air pollution to heart diseases or cardiovascular disorders in general?
Okay, thank you very much once again. I'm very happy to be here because I understand that this program is for educating the public, and this is what we are excited about. One, as a person, I'm so much interested in how much do we educate the public to live rightly, and then as a society which I lead, one of our key objectives is to take our message to the society, to the public. So I'm very grateful for you for doing this. A very nice contribution to humanity. Now, coming down to cardiovascular diseases, really, I need to make this first point that most people think that the challenge of air pollution is usually with respiratory diseases. So if you meet people on the street and ask them, why are you worried about the air? Then everybody will think because it causes cough and things that will affect the lungs.
The lungs, yes.
So one of the things we must leave this discussion with is that the main pathway through which air pollution causes its main problem, which is death actually, is through the cardiovascular diseases. And when we talk about cardiovascular diseases, we talk about diseases of the heart and blood vessels. So again, the air pollution will cause diseases of the lung. Not that it doesn't cause diseases of the lungs, that's the respiratory diseases. But the main pathway through which it causes death is through diseases of the heart. So let's get that clearly, and that's why we are really trying to emphasize the importance of air pollution. And you see, the main challenge with diseases of the heart and air pollution is that if, for example, you inhale some pollutants and you cough, after 1 week the cough stops, to you the problem is over.
The matter, yes.
But we know that the matter is not over, because those substances, they go through the lungs and then they enter the blood vessels. And when they enter into your blood vessels, they are carried around to all the vessels of the body. And when they go to all these vessels of the body, they destroy the internal lining of the vessel. The internal lining of the vessel is supposed to be smooth, so that as blood is flowing, it's flowing freely. Okay. But when these substances, yes, they may enter through the lungs very easily, which is the easiest place through which they enter. But we may not know that what we call the lung is actually a big sac with, you have a lot of
blood vessels.
You know, and then a lot of blood vessels all around it. By the way, why is it that if you don't breathe, you will die? It's because the same oxygen that is in the air that you breathe gets into your lungs, but that oxygen gets into the blood
system. Yes.
The blood system. So if the air can enter into the lungs, the same way that all these substances can also enter into the bloodstream, okay, and is carried around the body to different parts of the blood vessel. And the thing again about the blood vessel is that provided that part of the body is alive, there is blood vessel there.
So it's all over the body.
It's all over the body.
So whatever pollutants, toxic substances can damage.
So air pollution can actually affect every system of the body. But we needed to have this basic understanding so that we will understand why we are not just talking about cough and all that. So that you won't think that since I'm not having cough from air pollution, then I'm fine, there is no problem. Okay. Or if the cough happens and then goes, then that's the end of it. Okay, so I think that is very important.
So we now concentrate on blood cardiovascular disorders. So what are the common cardiac diseases that will relate to pollution, either air pollution or just pure environmental pollution, including noise pollution?
Yes, there are many. But let's start with the one that is very common that everybody knows, which is hypertension. Air pollution actually increases our blood pressure. Air pollution will cause a damage to the lining of the blood vessels, and then lipids, the cholesterol will not easily deposit on it.
The fat deposits.
And then begin to block the blood vessel. And when the blood vessels are blocked, it causes ischemia. Ischemia just means that blood is not getting properly where it is supposed to get. Yes. So if it is in the blood vessels around the heart, it gives you what we call coronary artery disease. So you have ischemia, and that there is the person may develop from there what we call heart attack. You know, the person can develop heart failure. The person can develop even stroke. I mean, you know, the general public would think that the only cause of stroke is hypertension.
But hypertension can result from air pollution.
Air pollution. And then the hypertension will now cause the stroke. And the air pollution itself can also affect the blood vessels of the brain and help in, you know, making faster the process through which hypertension causes stroke. Okay. But there is also another one that is very important that has been clearly brought out in this meeting that we are having by Nigerian Cardiac Society. We also discovered that air pollution is also a major cause of congenital heart diseases.
So which is hole in the heart?
Yes, which is like saying that there is hole in the heart. You know, from the results that we are presented to us here by, you know, our colleagues who are working in Port Harcourt here, we discovered that while other parts of the country were having, you know, fewer number of children that are born with congenital heart disease, that in Port Harcourt here, with the results that our colleagues showed, is about 3-4 times what it is
that all of the rest of the body.
Country. Yes.
That's alarming.
Yeah, it is. It is. And we are really worried. We have been discussing this since we started this meeting, that this may be as a result of air pollution that is very common around this part.
Yes, apart from air pollution in Port Harcourt, you know, this there was a time of we had the black suit covering the whole of the place. People were breathing in black smoke, black substances, staining your hands, if you stain your lung, your clothing, everywhere will be stained with black soap. So that is still there, but it's not as much as it used to be. But beyond that, water is contaminated with oil spillages and so on. People still get their water from these same rivers, the wells that have been contaminated. And there are other things in the environment, for example, spillage of oil, crude oil to farms, and people harvest these crops and they still eat them. So there's a lot of pollution in Rivers State, Port Harcourt being the capital city of Rivers State. So some of these conditions, these children come from the hinterland and usually come to Port Harcourt for treatment and so on. So no wonder, therefore, that we have this high rate of abnormalities in some of the children.
And this is really very worrisome. Children who have not yet been born, and then they are developing this in the womb, and the cost of treatment of many of those abnormalities are just so much. And not only that, it brings a lot of burden even for the families. A mother and a father who has a child with any of these congenital abnormalities is in trouble. So it brings a lot of economic burden, economic burden. And remember that if any of those parents has any of the heart diseases we talked about, and then their child also has
serious problem.
So I think that is why we are talking about this.
Air pollution and water
Another one that we also have to talk about really is that even from vehicles.
Especially emission from exhaust.
In this city where you have a lot of vehicles, and I'm glad that when we came into the city, we discovered that traffic jam is less compared to.
Because people can no longer afford petrol as they used to. That is why, because it used to be traffic jam everywhere. But now it's a bit less.
Because with that traffic jam, you see that there's a lot of exhaust fumes coming out, and people will be staying in one position. People are on motorbikes, you know, and if you are on motorbikes like that, you inhale.
So there's a lot of evidence that pollution causes cardiac disease, even respiratory disease, as you have mentioned, cardiac disease, and other forms of disorders. So the people here should try and avoid air pollution. How do we do that? It's everywhere.
Well, it's such a difficult thing. You know, government must come in because, I mean, it's really beyond what you can do. However, as individuals, there are a few things we can do ourselves to help ourselves. Let's start with even indoor air pollution, which we didn't mention, people cooking
with firewood
and all that. There are now improved stoves and even kerosene. You see, kerosene is not a very good fuel for cooking. We know things are quite difficult. For some poor people, it is only that kerosene that they can
The
afford.
kerosene is not well refined. It's not from, it's refined from crude oil, but in a very crude manner. Most of it is from what we call coal fire, which is itinerant refineries, which are really not ideal.
So you come into a kitchen where they are cooking with kerosene, you see a lot of black suits. So it's also not very good. But then how do you help yourself? Make sure that you have good ventilation in the kitchen so that even when this thing comes on, it would go out. It is even better to, if you must use those firewood to cook outside. By the way, our people have reason that to say that our forefathers were cooking with firewood. Did they all die? But they were staying outside.
They were cooking outside, not in the within the confines of their rooms.
Of the room. So I think that is one very important one. And people who have children, when you have little babies, they close up all the windows with the belief that the child is still quite small, and then they may lit a kerosene lamp. I don't know whether people still use it around here. They lit a kerosene lamp inside the room. Some of those things...
and then oxygen content goes down because the fire also takes oxygen.
So that's one. And I think too that if we plant, trees can help.
Environment.
Yes. One is that they release a lot of oxygen for us. And two is that they can even take some of those deposits. If you have the deposits
absorb the pollutants.
Yes, they can absorb some of
the carbon dioxide, for example, from the trees and bring out
oxygen. So this is also one way. But I think majority of what will be done, government has to come in.
Yes, policy of pollution laws.
Yes, it must come in. We cannot continue to live like this, because everybody is affected. If you are the one who is supposed to make the law and you don't do it, you are affected because you can't create your own air.
Everybody is affected.
Everybody is affected.
Okay, and to make matters worse, people also smoke on top of this.
Yes, we didn't even talk about that one, which is also another major challenge. People smoke and then they come into clubs, they smoke, and release more of these pollutants. So those ones that are really within our control, please, we shouldn't do and cause more trouble for ourselves.
Thank you very much, Professor Odili. We are particularly delighted that you are here. Thank you very much for coming and talking to us on pollution, cardiovascular disorders. I think we've learned quite a bit. It's an eye-opener because most of us will think that pollution will relate only to lung diseases, carcinogens that can maybe cause cancer, things like that. They do, but they also cause heart disorders, congenital abnormalities in children, hypertension and stroke, hypertension, other hypertension-related disorders, heart attack, heart failure, and so on. So we have to do something about pollution generally, environmental pollution. There is a cleanup going on in polluted areas in Ogoni land, for example, and we hope that that cleanup will be effective. There are other areas where there be oil spillages entering our water, contaminating the water, contaminating the soil, and of course there's pollution in the air. So all this we think should be taken care of to make our people more healthy. Thank you, Prof, for coming.
Thank you very much. It's my good pleasure, and please feel free to still involve me in any way we can to make sure that our people live healthier. It's really it's something that excites us.
Thank you very much.
Thank you, sir.
Viewers, thank you for viewing This is Optimum Health For All, and we hope you will join our family by subscribing. Subscription is free. Thank you.
Optimum Health For All, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's Optimum Health, yeah, it's for all. Knowledge is wealth, so we pass it on quick. From the food to the mood, we be flipping the script. From gut to brain, everything aligned. When you live that good life, it's a powerful sign. Balance is the machine, get the vision on deck. Cut the stress, no mess, keep the wellness in check. When we thrive, we shine with every routine. Optimum Health, you know what I mean. Optimum Health for all.